So I'm going to share a comment with you around our visitor policy. So every week we talk about whether or not we're going to loosen the restrictions on the visitor policy, and I believe we are staying the course at no visitors at this time, with except for the exceptions.
Right.
And we've talked about those exceptions on this call. So this comment came in today. So one of our community members is hearing that family members of patients are not being updated on the condition of their family members with any consistency. Calls and messages are not returned, especially from hospitalists. This is very difficult for older patients who are having a hard time processing what is happening to them and cannot share details with their families. So I have forwarded this message to our clinical leadership team, but I wanted you to know about this message and to be able to address this concern.
Yeah, I mean, that's disappointing to hear because, as I've said before, the most gut-wrenching, most difficult thing that we've had to do through this whole thing is to implement the no visitor policy that we have.
Right.
You've heard me say that, you know, if ever there was a time that a loved one needs the support of their family by their side, holding their hand when they're scared and anxious, and it would be now. But then because of just the risks and everything and not wanting to expose those patients or the healthcare workers that take care of them, we had to implement that. And you know, virtually every hospital that I know across the country has done the same thing. So alternatively, it became really, really important that we had had a way to communicate still with the family, to let them know how their loved one was doing and to give them daily updates, and ideally, you know, coming from the physician themselves, like the hospitalist, or coming from a nurse, being able to FaceTime with them. So a no visitor policy only works when you have a very effective alternative way to communicate between the patient, the family, and the healthcare workers. So that what you describe is clearly not the way it should be happening, and I'm glad you reached out to our folks to address that, and I will do so as well. I think it is important to remember that I think we ask the patient or the family to designate somebody formally that will be the point of contact, and I think we're trying to limit the contact with that designated person. So I don't know if this has anything to do with that, but if other family members who are understandably interested in knowing how grandma or mom, or if they're calling in too, but they're not the designated person, perhaps maybe that's why they're not calling them back, or and I don't know that to be the case, but definitely we need to address that.
Okay.
Now, at the same time, the command center, I'm in there every day, and I'm personally leading the charge to, you know, change our visitor policy, to start kind of loosening it up. I happen to know somebody that had surgery recently at Community Regional Medical Center. They had a no visitor policy, but now they're allowing a loved one to actually go back into the pre-operating area and be with their loved one until they go into the OR, and then they're brought out to the waiting room. Only one person. They have to wear a mask the entire time. They you know, have to have their temperature. They get screened and everything. But that's a recent change for them. And they've recently started allowing elective surgeries to be done. So I brought that up, and so, you know, Jag and Ryan and the whole demobilization team are continuously reevaluating that and say, what time can we start to open up a little bit? So.
And as soon as we start to open up, you guys will be the first to know.
Absolutely.
So we will
Yes.
make sure that we get that out to you.